Extending thromboprophylaxis with betrixaban in acute ill medical patients. Definition of the case. Patients who are hospitalized for acute medical illnesses such as pneumonia, stroke, and heart failure are at increased risk for venous thromboembolism. Prolonged immobilization and risk factors such as an elevated D-dimer level and age of 75 years or older, cancer, or a history of venous thromboembolism increase this risk. Randomized controlled trials of parenteral anticoagulants versus placebo in such hospitalized medical patients have shown a reduction of more than 50% in the rate of venous thromboembolism, including fatal pulmonary embolism without an increase in mere bleeding.
If you are immobile for an extended period of time because of surgery, pregnancy, illness, or travel, you may be at risk for deep vein thrombosis, or DVT, a condition where a blood clot forms in a deep vein in the body, typically the leg. Unlike arteries, which rely on the heart to force blood through them, veins transport blood with the help of muscle contractions while you move and walk. Veins also have valves that keep blood from flowing backward and pooling in your arms and legs. When you are immobile for an extended period, your venous circulation slows down. As a result, clotting factors in the blood may cause the slow-moving blood to clump together, forming a blood clot or thrombus. This condition is called deep vein thrombosis, or DVT. Common symptoms of DVT include swelling of the leg or a vein in the leg, pain or tenderness in the area, increased warmth in the skin, and red or discolored skin. In some DVT cases, a blood clot may detach from a deep vein and join the bloodstream. The clot travels from the deep veins of the leg, through the veins of the abdomen, into the heart, and finally lodges in the pulmonary artery or its branches, blocking blood flow to the lungs. This condition, called pulmonary embolism, is very serious and may permanently damage a portion of the lung. If a clot is large, or if there are many clots, pulmonary embolism may also cause death. If you experience symptoms of PE, please tell your doctor or nurse immediately. These symptoms may include shortness of breath, a sudden sharp pain in the chest, a feeling of lightheadedness or dizziness, rapid or irregular heartbeat, or coughing that produces blood. To help prevent deep vein thrombosis and pulmonary embolism, your doctor may require you to do the following. Walk around periodically to keep the blood from pooling in your legs. Wear compression stockings, and take anti-clotting medication.
Venous thromboembolism, or VTE for short, is a leading cause of death worldwide. In the Western world, someone develops a VTE every 16 seconds. Manifestations of the disease are deep vein thrombosis and pulmonary embolism. The disease process starts, often in one of the large veins of the leg, with the formation of a blood clot. This can be due to vessel wall injuries, a pathological increase in the coagulability of the blood, or circulation deficits such as venous stasis. The resulting blood clot consists mostly of red blood cells, held loosely together by strands of fibrin. There is a considerable risk of such a fragile clot or parts of it breaking away and traveling with the bloodstream through the heart and into the lungs. Here, the clot or fragment of clot eventually blocks a pulmonary artery. The consequence, pulmonary embolism. The affected area of the lung is no longer available for the oxygenation of blood. This life-threatening outcome can be traced back to an inappropriately triggered physiological process, blood coagulation. Various medical conditions are associated with disrupted blood coagulation and therefore an increased risk of VTE. For instance, immobilization heightens the risk of hypercoagulability of the blood and venous stasis. Patients undergoing major orthopedic surgery, such as total hip or knee replacement, have an additional risk of vascular injury.
Applications in medicine. Thromboprophylaxis is any preventive measure or medication that reduces the likelihood of the formation of blood clots. Petrixaben is an anticoagulant drug which acts as direct factor 10A inhibitor. It is potent, orally active, and highly selective for factor 10A, being selected from a group of similar compounds for its low HERG affinity. Petrixaben has undergone human clinical trials for prevention of embolism after knee surgery and prevention of stroke following atrial fibrillation, with promising results. Petrixaben is currently being studied in a human clinical trial for extended duration thromboprophylaxis to prevent venous thromboembolism in acute medical ill patients.
First, I think we owe our listeners an update on Portola Pharmaceuticals, which we covered a month ago. What has happened since then?
It was a busy month. You know, we anticipated that it would be, right? I mean, we knew that they had a study that was going on for a drug that, you know, is designed to prevent blood clots in medically ill patients. And we knew that the data from that trial was going to get released probably by the end of March. And sure enough, that happened. Unfortunately, it wasn't the slam dunk that investors were hoping for.
Yeah, the stock itself lost 29% in the one day when this study was released. I can honestly say I was pretty shocked.
Yeah, it's disappointing. I mean, full disclosure, I'm a shareholder. I haven't made any changes to my position since the news came out. You know, but with that being said, you know, so you bear that in mind. You know, there are some reasons to think that, you know, all is not lost for the drug and for the company.
Right. And just as a quick recap, so the drug that we're talking about that caused this share price decline is Petrixaben, which was definitely the drug with the larger market opportunity, but is actually, for me at least, not quite the reason that I became interested in the company to begin with. So there is still hope, not only for Petrixaben, but for this other drug, which is andexanet alpha. If you're interested and you're not sure what we're talking about, go check out our episode from pretty much exactly a month ago, probably 4 episodes ago. We dig in a little bit more about Portola, or shoot us an email if you have any questions at industryfocus@fool.com. Yeah, Todd, you mentioned that you haven't made any changes to your position. I haven't either. I'm also a shareholder. I'll remind everybody that people on the show, we could have interest in the stocks that we talk about, and we do. The Motley Fool also could have formal recommendations for or against them. Don't buy or sell based solely on what you hear or what Todd and I say that we're doing. Definitely do your own research. But yeah, we wanted to give you all the heads up that there was some new news about Portola since we did talk about them.
You know, and Christine, I think just really quickly, because we get a lot to talk about today, you know, just to give people a flavor for what we're talking about as far as being disappointing. It was a huge trial, 7,500 people. The way the trial was designed was a little bit odd. In order to test the entire group to see how well the drug did, it had to first be statistically significant in improving blood clots in a intent to treat population, which was about 62% of the 7,500 people in the study. You needed to have a p-value, which is measure of significance of 0.05 or less to test the greater group. They came in at 0.054. So close enough where they still tested the entire group, and across the entire universe of patients, it was definitely below 0.05. But that still casts a little bit of doubt on how the FDA would view that information when Portola goes ahead and files for approval later this year. So of course there's question marks there on this drug, and then like you said, there's also indexinate alpha, which it would be, if approved in August, the first reversal agent for factor XA anticoagulants. That's big because, you know, factor XA coagulants are raking in $4 billion a year in sales, and that's on restricted use of them because there is no antidote yet.
Right. So essentially all is not lost with this company, but it was disappointing news to hear that Betrixaban didn't perform quite as well as we had been hoping. But I mean, I personally still see a lot of upside to this stock. But it's definitely a hang tight and keep your eye on the news sort of situation.
Cancer patients are at really high risk for getting blood clots, and once they get a blood clot, it's actually very impactful on their clinical course. So they're more likely to have morbidity, swelling, pain, more likely to be admitted to the hospital, more likely to need anticoagulation for almost an indefinite period of time, and it's the second leading cause of death in patients with cancer. So after cancer itself, thrombosis is the second leading cause. So it's certainly something that needs to be prevented. The challenge has been that the risk for getting blood clots is very variable amongst cancer patients. There's some cancer patients that are at really high risk and some patients that don't have that much risk. So the reason we did the study was to pick just the high-risk patients, and we picked them based on a risk score that we had developed a few years ago. And only the high-risk patients were randomized to receiving deltapirin, which is a low molecular weight heparin, versus observation. The study essentially proved that, first of all, the high-risk patients were at really high risk. So 9% of them had a blood clot even before they started on chemotherapy. And an additional 21% in the observation arm developed a blood clot over the 12-week period, which is not that long to get a blood clot. Yeah, so the risk score is a very simple score. It takes 5 simple clinical and lab variables: the type of cancer, the components of the complete blood count, so the hemoglobin, leukocyte count, platelet count, and the BMI. So it's all really simple stuff that every cancer patient has. We published this in 2008, and since then it's been validated in over 13,000 patients. So it's been studied sort of left and right, and every study that's looked at it in a careful way has been able to validate it. So it's accepted by ASCO as the only validated risk assessment tool, and it's great because it uses these simple variables, and you can really identify high-risk patients very quickly. So the take-home message is there are some cancer patients that are really high risk for blood clots, and that risk is preventable. So identifying them partly by screening. So if somebody has a score of 3 or higher, maybe you should be looking at the lower extremities, making sure they don't already have a blood clot. And partly by using prophylaxis, preventive therapy. And at least educating patients, making sure they understand the warning signs and symptoms of DVT and PE is really important.
Pros and cons. The advantage of using anticoagulants is preventing emboli or thrombosis. However, anticoagulants have adverse effects if they are not well controlled, as bleeding, tenderness, and others. We can use Betrixaban with safe control. It is safer and has fewer side effects. Can be used in patients with renal impairment. In Ecuador, this drug has not reached Ecuador. It is originally from the US, and Latin America has come to countries like Uruguay, Argentina, and Mexico. Conclusion. In conclusion, it could be a comparison of extended duration thromboprophylaxis with Betrixaban and shortened duration enoxaparin in acutely ill medical patients. There was no significant between-group difference in the pre-specified primary efficacy outcome among the patients with an elevated D-dimer level. However, pre-specified exploratory analysis provide evidence suggesting a benefit for betrixine.
At the site of vessel injury, the first platelets arrive to start sealing the wound. Simultaneously, the coagulation cascade with its various coagulation factors is activated. This involves two pathways, the extrinsic and the intrinsic pathway. Extrinsic activation begins with now exposed molecules of the vessel wall, such as tissue factor, which forms a complex with factor 7. Finally leading to the activation of factor 10. This factor 10A is the point at which the extrinsic and the intrinsic pathways of the coagulation cascade meet. The intrinsic pathway consists of various coagulation factors activating each other in a chain reaction. At its end, a complex with an additional cofactor is formed. This complex now activates factor 10. Since the two pathways merge at the level of factor 10A, this factor has a pivotal role in the coagulation cascade. Further down the cascade, factor 10A in combination with 5A activates thrombin and induces the so-called thrombin burst. One molecule of factor 10A can catalyze the formation of 1,000 molecules of thrombin. These large amounts of thrombin cause the further activation of platelets and the enhanced formation of fibrin. Fibrin then forms strands, making up the mesh that stabilizes the platelet plug in an arterial clot and holds together the red blood cells in a venous clot. It can be concluded that the central role of factor 10A in the coagulation cascade makes it a viable target for therapeutic intervention in pathologically altered blood coagulation.